Some nurses think a bleeding heart compensates for marginal competence. That is what Dr. Whitfield said 47 minutes before Ashley Cooper performed an impossible surgery with her bare hands inside a dying man's chest. Cedar Creek Medical in San Antonio smells like antiseptic and floor wax under fluorescent lights that hum at a frequency designed to make time feel suspended. Ashley moves through the ICU with mechanical precision at 6:15 a.m., her hand steady as she checks vitals on a recovering Navy SEAL in bed 7. The patient's right forearm bears a tattoo in block letters, her name, rendered in ink by a man whose face she'd never seen clearly through the dust and blood of Bagram. She can read it now. It says Ashley. She does not allow her expression to change. She adjusts the foredrip instead, checking the flow rate, checking the surgical drain, checking everything twice because checking things is what saves lives and lives are all that matter. The tarnished challenge coin in her scrub pocket feels heavier than it should. She touches it unconsciously between rooms, the way other people touch wedding rings or prayer beads. This one is different. It has no inscription. It has only the weight of 15 years and the blood of men she carried through terrain that tried to kill them all. The SEAL's name is Garcia. His chart says he arrived at Cedar Creek 3 days ago with penetrating trauma to the right upper quadrant, shrapnel from an IED in the Sanjin Valley, Helmand Province. The surgical notes indicate successful repair of the hepatic artery by Dr. Whitfield himself. The drain is producing clear serous fluid. The heart monitor shows a steady 68 beats per minute. Sinus rhythm. Stable. Everything by protocol except for one thing. Ashley has stayed 4 hours past her scheduled shift end time, and she will stay for more if necessary, because the post-operative complication pattern she's been documenting for the last 18 months shows that Whitfield's patients develop infections at a rate 340% higher than the national average. And Garcia's chart is flagged for early discharge tomorrow morning despite clinical indicators suggesting he should remain admitted another 72 hours minimum. She does not know that Whitfield has noticed her overtime. She does not know that he has already made notes. She does not know that his institutional power, 7 years as director of trauma surgery, a tenure secured by metrics and connections and a brother-in-law who sits on the hospital's board of trustees, is about to collide with hers. What she knows is that Garcia's temperature is 37.2 Celsius. His white blood cell count is elevated. His drain output is increasing. She knows because she has checked these numbers 17 times in the last 4 hours. She knows because her hands remember how to read the smallest signals, the ones that separate living from dying. At 7:13 a.m., the fluorescent lights buzz and flicker as the night shift transitions to day shift. The hallway fills with voices. Residents in short coats begin arriving for grand rounds. There are 10 of them today, rotating through Cedar Creek for their trauma rotation, each one competing for Whitfield's attention, each one believing that his recommendation will determine the trajectory of their careers. They file into the conference room on the 2nd floor. Whiteboards line the walls. Patient charts are projected on screens. Dr. Whitfield stands at the center of the room the way some men stand, not because they are physically larger, but because they have arranged their life so that all the light collects around them. Ashley is not in the conference room. She is in the ICU, charting her findings on Garcia's record when the intercom crackles and a voice announces that grand rounds will include a brief discussion of protocol compliance and post-operative decision-making. The announcement is routine. The tone is not. She finishes her documentation. She updates the medication log. She does all of this with the kind of focus that comes from knowing what happens when you lose focus. Her hands do not shake. Her jaw does not tighten. She exists in her body the way a soldier exists in foxhole, present, alert, unafraid. At 8:45 a.m., grand rounds concludes and the residents file out of the conference room, their expressions ranging from satisfied to shell-shocked. They move toward the elevators. They move toward the ICU. And Dr. Whitfield moves toward the vending machine on the 2nd floor, where he encounters Ashley as she is inserting a dollar bill into the slot. The hallway is mostly empty. A resident is at the far end, reviewing a chart. A custodian is mopping near the stairwell. The vending machine hisses and clicks as it dispenses a cup of coffee. Cooper. Whitfield's voice carries the kind of casual cruelty that only works when delivered by someone who believes they are untouchable. A moment. Ashley retrieves her coffee. She does not turn immediately. She removes the cup from the dispenser. She places the lid on top. When she turns to face him, her expression is neutral as a door. Her eyes are flat. She is waiting. Whitfield is standing close enough that she can smell his cologne, something expensive and chemical, like money trying to smell like authority. He is not alone. Dr. Morris, another attending, stands 3 feet behind him, reviewing something on his phone with studied disinterest. "I wanted you to know," Whitfield says, "that I observed your unauthorized overtime on Garcia's account. For hours past shift end. That is not protocol." Ashley does not respond. She lifts the coffee cup slightly, a gesture that might mean acknowledgement or might mean nothing at all. "Some nurses," Whitfield continues, and his voice lifts slightly, ensuring that his words travel down the hallway, ensuring that anyone nearby hears him clearly, seem to believe that a bleeding heart compensates for marginal competence. They believe that emotional attachment to patients overrides the chain of command. They believe that their judgment supersedes established protocol. He pauses. He allows this to settle in the space between them. These nurses are incorrect. Ashley's left leg aches, an old injury from Helmand Province, from a day when an Afghan soldier stepped on an IED and Ashley had carried him 3 kilometers to a landing zone while rounds snapped past her head like angry hornets. The pain is dull now, mostly background, but it surfaces when she stands still for too long. She shifts her weight slightly, favoring her right side. Her face does not change. "If I observe any further protocol violations," Whitfield says, "I will personally request that hospital security escort you from the building." "Is that clear?" "Clear, Doctor," Ashley says. Her voice is quiet. It sounds like someone who has learned to take up as little space as possible. It sounds like a nurse who accepts her place in the hierarchy. It sounds like someone who does not carry classified intelligence on the surgical fraud patterns unfolding beneath Whitfield's careful statistics. It sounds like someone who knows how to disappear. Whitfield nods. He turns away. He says something to Dr. Morris about protocol adherence and institutional culture and the difficulties of managing nursing staff who refuse to understand boundaries. His voice fades as he moves down the hallway, toward the elevators, toward his office on the 5th floor. Ashley finishes her coffee. The cup is still hot. The vending machine's lights flicker, blue and red and blue again, cycling through colors that somehow make the fluorescent hum sound louder. She works the remainder of her shift with the kind of precision that only comes from experience. She checks Garcia's vitals every 30 minutes. She documents everything. She remains on the ICU floor until 2:41 p.m., until the day's shift is fully staffed, until she can leave without drawing attention. She does not look back at Garcia's room. She does not allow her expression to change. What she does do, when she reaches the supply closet on the 4th floor, the one near the old pharmacy that was converted into storage 3 years ago, the one that no one uses anymore because the new pharmacy is more efficient, is lock herself inside. The door is metal and cool. The shelves around her hold bandages and dressings and suture kits, all organized by the people who came before her. The fluorescent light above her head is broken. It has been broken for months. Darkness is better. She presses her forehead against the cool metal shelving. Just her forehead. Nothing else moves. Her hands hang at her sides. Her breathing is controlled. And then, only then, in the darkness where no one can see, where no hierarchy can reach her, where no doctor can weaponize her compassion, she allows the pressure to release. Her shoulders shake. Silent. The kind of crying that sounds like nothing at all, that could be mistaken for breathing, that is the sound of someone learning again what it means to be powerless. It lasts 3 minutes. Maybe 4. She does not time it. She does not count the shakes or the breaths or the individual moments of breaking. She simply exists in the darkness until the pressure passes, until the tension in her chest converts back into steel, until her hands stop trembling and become hands again. Then she washes her face in the break room sink. She checks her reflection. The nurse from downstairs looks back at her, steady, professional, unremarkable. A person with a slight limp and a quiet voice and a job that will never be enough for people like Whitfield. A person who accepts her place. A person who knows her role. But the woman in the mirror, the one with eyes that have seen terrain most people never survive, eyes that have watched men die and carried their bodies toward safety, eyes that have read Ashley's own name tattooed on a patient's arm and understood instantly what it meant, that woman is still there. Quiet. Patient. Waiting. And that woman is about to change everything. The third morning arrived like any other shift, fluorescent lights humming their electric drone, the antiseptic smell of Cedar Creek Medical sharp enough to cut through coffee breath, Ashley's badge clipped precisely at her collarbone with the same practiced efficiency she brought to every 12-hour rotation. She'd learned long ago that consistency was camouflage. One foot in front of the other. No variation. No tells. Dr. Whitfield's words still echoed in the stairwell where she'd heard them 3 days ago at the vending machines, but her face revealed nothing. Never revealed anything. That was the skill that kept operatives alive in hostile territory, and this hallway was hostile in ways the residents would never understand. The fourth-floor patient roster lay on the nursing station counter, printed at 6:11 a.m., and there it was, Garcia, Marcus. Navy SEAL. Bagram wound recovery, day 17 post-op, status upgraded to alert and oriented ×3. Her breath remained perfectly level. She picked up his chart, 12 pages thick now, filled with vital signs trending toward normal, medication adjustments, physical therapy clearance notes, and walked to his room without rushing. Rushing meant emotion. Emotion meant exposure. The door was half open. She could hear him before she saw him, breathing that came in full deep patterns instead of the ventilator's mechanical wheeze, the rustle of movement under the cotton blanket, the slight shift of someone learning how their body worked again after trauma had rewired everything. When she stepped into the room, Garcia's eyes found her immediately. Those eyes had seen things in Helmand Province that would have broken most people into fragments. Morphine and fever dreams had hazed them for 3 days, but now there was focus returning, dangerous, searching focus, and it locked directly onto her face. "Do I know you?" His voice came out raw, the vocal cords still learning their job after the intubation tube. His left arm, the one with her name tattooed in block letters across the bicep, lay at his side, and she watched his eyes track downward to the ink, then back up to her face, then to her name badge. Ashley Cooper, RN. Back again. Muscle memory. Combat instinct trying to place a familiar voice in a familiar face that didn't match his fragmented memories of sand and blood and chaos. She moved to the bedside with the smooth efficiency of someone who had performed this particular dance 7,000 times. The heart monitor beeped its steady rhythm, 68 beats per minute, strong, no arrhythmias. His oxygen saturation at 98% on room air. Blood pressure 127/84. The numbers told her what her eyes already knew: he was healing. The body was winning its argument with trauma. "Just your nurse, Chief," she said, keeping her voice level, professional, stripped of anything that might trigger recognition. Her hands checked the 4 line at his wrist, saline running clear, no signs of infiltration, the insertion site clean and uninfected. She'd been here when they placed it, had advocated for a smaller gauge needle to minimize vein damage, had stayed an extra 4 hours to monitor for complications. He had no memory of that. To him, she was a stranger in scrubs whose name appeared on his arm in permanent ink for reasons his morphine-hazed mind couldn't yet assemble. "You were there," he whispered. His eyes went distant. Bagram. The dust. Someone was. He reached for the memory like it was tangible, like reaching would make it coalesce into something coherent instead of fragments that scattered the moment he tried to hold them. Ashley placed one finger gently on his wrist, a grounding point, the kind of light touch that military-trained people recognized as a command even when it looked like tenderness. "Rest now," she said. "Doctor's rounds in an hour." You need your strength. She shifted to his for pump, checked the drip rate, 15 milliliters per hour, exactly as ordered, and added a note to his chart with her shift timestamp. Everything documented. Everything traceable. Everything safe. The professional distance between caregiver and patient was a wall she'd built perfectly, but she could feel it cracking from the inside, pressure building behind her sternum like a held breath that had no permission to release. His eyes followed her as she moved through the room. She felt the weight of his attention the way soldiers feel the weight of a targeting laser. That's when the real nightmare began, not the humiliation from Dr. Whitfield, not the threat of losing her position at Cedar Creek, but this, being present with someone she'd carried through gunfire and dust, someone whose name she'd whispered when they were both certain death was the only possible outcome, and having that person see her face for the first time while she remained invisible. A stranger with a familiar tattoo. A voice with no context. Before she left, she glanced at his arm one more time. Ashley Cooper in neat black capital letters. She had no memory of giving permission for that. Had no memory of even telling him her real name through the chaos. The morphine he'd been on in the first 72 hours had probably recorded things his conscious mind had forgotten, conversations he'd had while half dreaming, details shared in moments between consciousness and the dark. Intelligence work had taught her that trauma victims often reveal their deepest information in the fragmented space between survival and safety. She'd just never expected to see it permanently etched into someone's skin. The shift moved forward in the way shifts do when you're trained to compartmentalize. A post-op spinal fusion patient needed help moving to prevent blood clots. An elderly woman admitted with congestive heart failure required careful monitoring of her diuretic response. A teenager recovering from appendicitis needed encouragement to use the incentive spirometer to keep his lungs clear. Ashley moved between these rooms with the automatic precision that only came from thousands of hours of practice, her hand steady, her voice calm, her attention divided into segments that allowed her to be fully present for each patient while part of her remained elsewhere entirely. Garcia's room. He's awakening. His eyes searching her face for something his brain couldn't quite retrieve. At 11:16 a.m., Dr. Whitfield entered Garcia's room for rounds. Ashley was checking the catheter output, 200 milliliters of dark urine, which meant adequate hydration and kidney function holding steady. She stepped back, giving him space, and watched his interaction with the patient with the clinical eye she developed for assessing dangerous people. Whitfield was competent. That was what made him truly threatening. His exam was thorough. His questions were appropriate. His manner with Garcia was exactly what medical school had probably taught him it should be, authoritative but not unkind, professional but not cold. A textbook attending physician. If you didn't know he'd called security to have her escorted out if she violated his standing orders, if you hadn't heard him at the vending machine comparing her to some kind of sentimental liability, you might actually respect him. Recovery progressing well, Whitfield said, reviewing the chart. Physical therapy tomorrow. We'll start him on the stair protocol if toleration is good. Nurse Cooper, make sure all ambulation is supervised and documented. The way he said her name, Cooper, not Ashley, not nurse, carried a weight that only she seemed to hear. Everyone else heard an attending physician delegating tasks. She heard a threat wrapped in professionalism. Understood, doctor, she said quietly. Not yes, sir. Not cheerfully. Just a neutral acknowledgement. The kind of response that gave him nothing to grab hold of, nothing to use as evidence of emotional investment or protocol violation. Garcia watched this entire exchange, his eyes moving between them like he was trying to decode something in the subtext. His consciousness was returning faster than the morphine could cloud it. That was dangerous. Every hour that passed brought him closer to the moment when fragmented memories might suddenly crystallize into clear images. Every hour brought her closer to the moment when he might remember her voice saying things in Dari, in English, in the kind of fractured emotional state that combat creates. That evening, her daughter Emma was waiting at the kitchen table when Ashley arrived home. 7-year-old Emma, bright, observant Emma who missed nothing, had done homework and eaten the dinner the neighbor had left. But her eyes tracked Ashley's movements with the intensity of a child who sensed something had shifted in her mother's orbit. "Mommy, why does that man have your name?" Emma asked, her voice small but direct. Children had a way of asking questions with the precision of a scalpel. No social filters. No understanding of why some things weren't supposed to be discussed out loud. Ashley froze at the stove, spatula suspended over the pasta like it had suddenly become a foreign object. The steam rose from the boiling water, carrying with it the smell of garlic and basil, ordinary smells for an ordinary evening that had just become something else entirely. She set the spatula down with deliberate care and turned to face her daughter. "Sometimes soldiers remember the people who helped them," Ashley said carefully. Each word placed like she was laying a minefield. Too much truth and Emma would sense it. Too little and her intelligent daughter would keep pressing. They carry those memories with them. Emma considered this with the solemnity that childhood sometimes possessed. She wasn't satisfied. Ashley could read that in the slight furrow between her eyebrows, but she was willing to accept it as an answer. For now. Until her mind got bigger and sharper and eventually understood exactly what those tattoos meant. Later, after Emma was asleep, Ashley sat at the kitchen table in the dark. Her phone lay in front of her, screen dark, refusing to light up with messages that she knew would come. Her Navy intelligence handler was already preparing the follow-up. Situation developing. Maintain cover. For words that meant everything was about to accelerate. The patient was waking. The patient was remembering. The patient was asking questions that, when fully answered, would blow apart the careful fiction she'd constructed at Cedar Creek Medical. She reached into her scrub pocket and felt the tarnished challenge coin there, worn smooth from decades of handling, scarred from shrapnel and sand and the particular degradation that came from being carried through 3 combat tours. This coin was older than her Navy service. It had belonged to someone else before her, passed down through a lineage of operators who understood that sometimes the most important work happened when no one was watching. Sometimes the most important battles were fought in quiet hallways under fluorescent lights, carrying patients through psychological trauma that had no medical code. The silence in the house was absolute. Emma sleeping upstairs. The neighbor's dog barking distantly somewhere down the block. Her own heartbeat steady, controlled, the biological equivalent of her professional voice. She allowed herself 60 seconds to feel the weight of everything. The contradiction. The impossible mathematics of being 2 people at once, a single mother struggling to keep a civilian life stable, and a Master Chief Petty Officer trained in medical trauma protocols and combat intelligence operations. Being Ashley Cooper the nurse, and being the woman whose name a SEAL had whispered in a hospital room in Bagram while his blood soaked through gauge that she'd packed with her own hands. She deleted the message from her handler. She put the coin back in her pocket. She went upstairs and stood in the doorway of Emma's room for 3 minutes, watching her daughter sleep, and then she came back downstairs to the dark kitchen and waited for the next shift to arrive, understanding with absolute clarity that everything was about to change in ways even she couldn't predict. The phone buzzed one more time. A single text from a number not in her contacts. "Chief. I remember now. Thank you." Ashley set the phone face down on the table. She didn't respond. Not yet. Not until she understood exactly what game was being played and who held the highest cards. For now, she would do what she'd done for 17 years, she would wait. And that woman was about to change everything. The afternoon light filtered through Cedar Creek Medical's south-facing windows at 2:44 p.m. when the monitor alarm over bed 12 became the worst sound Ashley Cooper had heard in 7 years of civilian practice. Reynolds. The SEAL she'd been monitoring post-op, the graft repair that should have held until discharge, the young man who'd already survived Kandahar twice. His chest heaved against the oxygen mask. His lips turned the color of slate. The arterial graft was failing. She knew it before the EKG confirmed it, before his blood pressure began its catastrophic collapse into shock ranges. 75/50. Dropping. His skin went clammy as his body redirected blood away from his extremities in a last desperate bid to save his core. 70/40. His oxygen saturation began its descent, 92. 88. The monitor showed the telltale signs of profound hypovolemia, his heart racing at 142 beats per minute, trying to compensate for vessels that were flooding his abdomen with blood that should have stayed inside his vascular tree. Dr. Whitfield materialized at the bedside during grand rounds, his entourage of residents trailing behind like remora fish following a predator. His eyes scanned the monitors, and something cold moved across his face. Not concern. Assessment. Calculation. Get him prepped for transport to the OR, Whitfield commanded, his voice carrying the flat certainty of someone who had never been questioned. Vasculus in an emergency case. ETA 12 minutes. Keep him stable, maintain 2 large bore 4s, let's get a type and cross. His hand came up, blocking the direct path to the crash cart. His fingers were long and pale. Manicured. Hands that had never torn open a chest cavity while mortars fell. Stand down, Nurse Cooper. Surgical team is en route. Do not touch that patient. Protocol. His emphasis on the final word was deliberate, weaponized. A reminder. A threat. Ashley's jaw tightened microscopically. 90 seconds. That was the window before irreversible brain damage began, when oxygen deprivation past the blood-brain barrier crossed the point of no return. Reynolds' lips were already shifting toward cyanosis. His eyes had begun to glaze. 148 beats per minute now. His body was eating itself alive trying to maintain perfusion. Whitfield turned back to his residents. This is what happens when we let sentimentality override protocol. 12 minutes. The system works if we let it. The system. Ashley had seen what the system did in the Helmand province when transport took 40 minutes. She'd held organs that were supposed to stay inside bodies. She'd watched good men become statistics because protocols had been written by people who'd never heard the sound of a human chest cavity opening under field conditions. Reynolds gasped. His back arched. His hand found the bedrail and gripped it with a force that spoke of his body's primal understanding that something was dying. Not metaphorically. Now. 3 seconds. That was how long she calculated it would take to step around Whitfield, move 3 feet to the crash cart, and make the decision that would end her career at Cedar Creek Medical. 3 seconds to choose between a protocol that would work in a comfortable academic setting and a man whose brain was beginning to die because his graft had failed catastrophically in a way that textbooks said shouldn't happen but that happened every single day in the real world. She moved. Whitfield's voice rose. Nurse Cooper, do not, but she was already past him, her fingers closing around the scalpel's handle with the muscle memory of someone who had done this before, not in an operating room with 6 surgical nurses and anesthesia backup, but in the dirt outside a forward operating base near Bagram with nothing but a corpsman's kit and a decision that had to be made in seconds. The blade was cold. Precise. Her hands had become something other than a civilian nurse's hands. They became the hands of someone who had lived inside her own combat training so deeply that it had become automatic. Autonomic. The way her heart knew to beat without her thinking about it. She made the first incision along the 5th intercostal space, mid-axillary line. The scalpel hissed through skin and subcutaneous tissue with a sound like a whispered confession. Blood welled up immediately, his pressure was so low there was barely enough perfusion to bleed, which meant his organs were already beginning to fail. She pushed deeper, through the parietal pleura, and his right lung deflated with a sigh of released pressure. "Get me a rib spreader from the cart," she said. Her voice had changed. It was not a request. It was not negotiation. It was the voice of someone who had authority written into the very muscle memory of her body. The respiratory therapist who had been paralyzed in the moment moved immediately. The crash cart was already in motion before her words had fully left her mouth. Security was radioing for Dr. Whitfield's backup. A code was being called. But Ashley's hands plunged into Reynolds' open chest cavity, finding the failing heart in the pericardial sac, her fingers becoming a surgical instrument far more effective than any mechanical pump. She began direct cardiac massage. Manual compression of the ventricles, feeling the organ respond under her palm with a sensation like squeezing warm clay. Pump. Release. Pump. Release. Her other hand was braced against his sternum for leverage, her movements carrying the terrifying fluid precision of someone who had done this while taking fire, while the ground shook from nearby explosions, while the man she was trying to save had been hit by shrapnel that had already taken his left arm below the elbow. This was different geography. Same skill set. Same commitment. Blood soaked her scrubs past the elbows. It was warm and metallic smelling, and there was so much of it that she knew the graft site was still actively hemorrhaging. 85. 87. 90. The oxygen saturation was climbing. His heart rate was responding, actually responding, to direct perfusion under her hands instead of the failing pump of his own myocardium. "I've got an open chest here," the surgical resident was saying into his phone. "Bedside thoracotomy. Vitals improving. No, wait, she's doing direct cardiac massage. I don't, yes, I see that, approximately 90 seconds from onset." The doors burst open. The surgical team arrived with the violence of a rescue operation. For people in surgical caps and masks, moving like they had rehearsed this scenario 1,000 times. Which they had. Different patient. Same emergency. Ashley released the heart to the surgical attending's hands without being told. She had no clinical authority here. She had exactly enough authority to know when to step back. Reynolds' own heart took over as the surgeon began setting up for proper resuscitation. The surgical attending didn't thank her. He didn't acknowledge her. His entire universe had contracted to a single point, keeping this young man's organs perfused long enough to get him to the OR where they could actually fix the structural failure rather than compensate for it. Ashley stepped back, her hands dripping red, her face completely composed. The mask had not slipped. Her breathing remained controlled. Her shoulders were back. Her posture was that of someone who had just accomplished a medical miracle before breakfast on a Tuesday. Dr. Whitfield's face had gone white. Not pale. Not shocked. Absolutely, catastrophically white, the color of someone watching his version of reality collapse in real time. His lips had pressed into a thin line. His eyes had fixed on her hands, on the blood that covered her arms to the elbows, on the scalpel that was still in the crash cart where she had abandoned it. "You just ended your career," he said quietly. Not shouted. Quieter somehow made it worse. His voice carried the absolute certainty of someone who had spent 23 years using the machinery of institutional power like a scalpel of his own. "My office. 30 minutes. You are on immediate suspension pending investigation. Do not touch another patient." Ashley met his eyes for exactly 3 seconds. Long enough to let him see that she understood. Long enough to let him see that she had made her choice. Long enough to let him see that some things mattered more than careers. She peeled off her gloves without a word and followed him out, leaving Reynolds' blood on the floor of bed 12, leaving the surgical team already moving his stretcher toward the elevator, leaving the entire hospital in that peculiar state of suspended motion that follows when someone has just broken every rule and saved a life doing it. But that wasn't the worst part for Dr. Whitfield. The worst part was that he had no idea who he had just threatened. Whitfield's office door closed behind her with the finality of a courtroom verdict. He sat behind his mahogany desk, leather chair creaking as he leaned back, a legal pad already covered in notes written in aggressive slashes. Ashley stood 3 feet from the chair, blood still drying on her forearms in russet crescents beneath her pushed-up sleeves, her scrub stained with Reynolds fluids. She said nothing. The silence between them carried weight. Emergency thoracotomy without attending supervision. Whitfield's voice was clipped, precise, a man dictating his own victory. Violation of scope of practice. Unauthorized use of surgical equipment. Assault on a patient. He lifted his pen, tapping it against the pad like a metronome counting down her career. "I'm calling an emergency board meeting. Tonight." Ashley's jaw tightened microscopically. Her eyes remained flat, unreadable as a closed door. This was not shock. This was not fear. This was the look of someone watching a predictable enemy make predictable moves. Whitfield picked up the phone before she could respond. His fingers moved across the keypad with practiced authority. President Chen? Dr. Whitfield. Yes, I'll wait. He smiled at Ashley while the line connected. The smile had no warmth in it. Listen, we have a significant problem in the ICU. One of our nurses, he paused, letting the implication hang, performed an authorized cardiac surgery on a post-operative patient without attending supervision. Reckless cowboy medicine. The liability exposure is catastrophic. I need an emergency board meeting convened within 2 hours. Ashley listened to his side of the conversation, hearing the practiced concern in his voice, the way he deployed clinical language like a weapon. Every sentence was designed to make her actions sound not heroic, but dangerous. Not life-saving, but reckless. He hung up and immediately dialed another number. This is Dr. Marcus Whitfield from Cedar Creek Medical. I'm calling regarding one of your former employees, Ashley Cooper. RN credentials. Yes, I'll hold. He drummed his fingers on the desk, still watching her. I'm doing a reference check as part of a routine investigation. Can you confirm the scope of her nursing training? Specifically, any history of protocol violations? Any concerns about her judgment or her tendency to act outside her scope? He listened, nodding slowly. I see. And her performance ratings? Any patterns of insubordination? Thank you. Appreciate your time. He hung up and immediately reached for his computer, pulling up a contact list that seemed to expand infinitely. Ashley recognized the gesture, not a man making calls, but a man deploying an entire apparatus. His network. His allies. His leverage. The next call was different. Whitfield's voice shifted into something more formal, more menacing. Yes, I need to speak with the chief investigator for medical credentialing. Dr. Marcus Whitfield, Cedar Creek Medical in San Antonio. I have a critical issue. One of our staff nurses performed an unauthorized open-chest cardiac procedure today, a thoracotomy without supervision. Direct cardiac massage with her hands inside the patient's chest cavity. He paused, letting the other person react. Exactly. My concern is credential fraud. Her training doesn't align with her demonstrated abilities. Someone performing that procedure either has military or surgical experience that isn't reflected in her civilian file. I'm requesting an investigation into possible misrepresentation of her background. Ashley felt it then, the moment her cover began to disintegrate. Not quickly, but like a controlled demolition, each charge placed strategically. She knew naval intelligence was monitoring the hospital's phone system. She knew her handler was listening to this conversation in real time, ears pressed to a headset in some operational center, watching her mission collapse from a screen 3 states away. Whitfield set the phone down slowly, savoring the moment. He leaned back in his chair, fingers steepled beneath his chin like a chess master surveying the board after a decisive move. You can go home pending the board's decision. You're suspended effective immediately, pending investigation. Security will escort you out once you've secured your personal items. Ashley didn't move. Her breathing remained even, measured. To anyone watching, she appeared composed. To Whitfield, who was searching her face for cracks, it must have felt like pushing against stone. You performed cardiac surgery on a patient without authorization, he continued, and his voice carried the certainty of a man who believed he had already won. That's criminal negligence. The board will see it that way. The investigators will see it that way. Your career at Cedar Creek Medical is finished. She walked out without a word. Her composure remained absolute until she reached the nurse's locker room, where she gathered her jacket and her keys. A colleague tried to make eye contact. Ashley looked through her, the way one might look through reinforced glass. She didn't call her Navy handler. Not from the hospital. Not from anywhere that could be recorded. She simply drove home at 3:07 p.m., 3 hours before her shift ended, her hand steady on the wheel despite the knowledge that everything she had worked for, the cover, the mission, the entire operation monitoring surgical complications among returning service members was now compromised beyond recovery. The house was quiet when she arrived. Emma had a key. At 7 years old, she knew the protocol: straight to the kitchen table, snack box on the counter, homework on the placemat. But when Ashley opened the door, she found her daughter in the living room, school backpack still strapped to her shoulders, eyes red from crying. "Mommy." Emma's voice was small, uncertain in a way Ashley had never heard before. "Why are you home? You said no one gets sick after 3 o'clock. But people get sick after 3 o'clock, Mommy. You said so." Ashley felt something inside her cavity, something behind her sternum that had held together through 2 decades of combat, through watching men bleed out in her arms, through maintaining operational security through 100 careful lies. That thing fractured then. She didn't cry. Not visibly. But she moved to the kitchen table and sat down hard, her legs suddenly unable to carry her weight. Emma followed, confused and hurt in the way only children can be when their parents' promises suddenly fail. "Mommy, why are you home before dinner? Don't they need you?" Ashley couldn't answer. She reached for the small object she kept in her locker, the one thing she should have left behind but carried anyway, a military challenge coin, tarnished nearly black, made from shrapnel recovered after an IED strike in Helmand province. Her first confirmed kill saved her unit. The coin was what remained of the bomb that almost took her. She held it in her left hand, letting her daughter see the weight of it, and pulled Emma into her lap with her right arm. The coin pressed between them, cool and real against Emma's small back through her school uniform. Her daughter's voice continued, asking questions Ashley could not answer without breaking operational security, without lying, without choosing between her daughter's need for truth and her nation's need for secrecy. "Are you sad?" Emma asked. "Yes," Ashley said. The only honest thing she could say. "Because someone died." "No. No one died. The thoracotomy had saved Reynolds. The direct cardiac massage had worked. Sinus rhythm had returned. I saved someone today, Emma. I saved him." "Then why are you crying?" Ashley realized then that tears were streaming down her face, the first time since the supply closet at Cedar Creek, the first time she had let her composure fracture even in private. She held her daughter and didn't answer, because the answer was that sometimes saving one life costs you everything else, and sometimes the people who matter most don't understand why you're willing to pay that price. Her phone buzzed. A text from a number that should not exist: abort mission. Extraction Protocol Alpha. She read it once, committed the exact wording to memory, and deleted it without responding. Extraction meant leaving. It meant taking Emma and disappearing into a new identity, a new city, a new life where she would be nothing. Just another nurse. Just another divorced mother working double shifts to pay rent. She looked at her daughter's face, small and confused and trusting in a way that broke her heart, and made a choice that no one would authorize. She would not extract. She would not run. She would burn her cover completely if necessary, but she would face whatever was coming: the board, the investigators, the exposure of everything she had hidden. Because Emma had asked why people were still sick, and the answer was that they were. They always would be. And someone had to be there to save them. 2 weeks into administrative leave, Ashley returned to Cedar Creek Medical wearing the same scrubs she'd worn for 7 years, the same laminate badge clipped to her waist, the same face that had learned long ago not to flinch when the world decided who you were supposed to be. The suspension had been lifted. The external investigators had redirected their focus. She'd been reassigned to the ER under direct supervision, a symbolic demotion that felt like a promotion when measured against the alternative, which was never coming back at all. The tarnished challenge coin remained in her scrub pocket, warm against her hip. She touched it once as she clocked in, a habit she'd carried for 18 years. The ER at Cedar Creek hummed with its particular chaos that Tuesday afternoon, 3 trauma alerts pending, 2 beds full of chest pain patients waiting for EKGs, a child with croup crying loud enough to carry down the corridor. Ashley moved through the controlled frenzy with the precision of someone who'd learned to operate in far worse conditions, her hand steady, her movements efficient, her presence barely acknowledged by the rotating residents who'd learned to stop making eye contact with her. The mask held. It always held in public. But that wasn't the worst part. That wasn't even close. The radio crackled at 3:53 p.m. Incoming medical alert, ETA for minutes. Male, 42, acute renal failure, altered mental status, presenting from the Refugee Services Clinic on Medicaid. History of trauma, no English-speaking capability. Dari interpreter en route separately. Ashley didn't look up from the for she was prepping. The words meant nothing to her except as data points: renal failure, altered status, trauma history, language barrier. Standard ER intake. She'd processed 100 like it. She clipped the tourniquet around a patient's forearm and slid the needle home, 18-gauge angiocath, one smooth motion, the kind of action that didn't require thought anymore, just muscle memory and certainty. The stretcher wheel squeaked through the doors at 3:51 p.m., and the man on it had the hollow eyes of someone who'd been broken and duct-taped back together by people who didn't care about the seams. Renal failure darkened the rings beneath his eyes. His skin carried the ashen quality of a body shutting down from the inside. The paramedics rattled off vitals: BP 94/62, urine output virtually none in the past 18 hours, potassium likely critically elevated, fluid overload visible in the lower extremities. Standard presentation. Ashley's hands were already moving to grab the workup supplies before the stretcher even stopped rolling. And then he opened his eyes fully. His gaze locked onto her face with the recognition of someone seeing a ghost step out of a sandstorm. His mouth moved. His voice came out as barely a whisper, cracked and thin as paper, the words in Dari, a language she'd last heard screamed across a valley in Helmand province. Kahraman Marg, he breathed. Kahraman Marg. The angel of death. The room did not, in fact, go dead silent. The monitors continued their electronic song. The ventilators wheezed. A patient down the corridor was still calling for pain medication. But something fundamental shifted in the pressure, in the weight of air, in the way every person within earshot suddenly stopped moving at exactly the same moment. Ashley's hands froze for exactly 1/10 of a second, enough time to acknowledge the fracture, not enough time for anyone to document it. She did not look at him. She continued prepping. Her voice, when she spoke, had dropped an octave. Get him to Bay 4. Standard renal protocol. I need a Foley catheter, 12-lead EKG, full metabolic panel, and I want urine output tracked every 15 minutes. It wasn't a request. It was a command. The resident who'd been standing by the trauma supplies moved. The nurses moved. Everyone moved except the man on the stretcher, whose eyes tracked Ashley's movements as if she might disappear if he looked away long enough. A veteran hospital security guard, Marcus Hayes, who'd worked Cedar Creek for 11 years and whose own son was a Navy photographer attached to SOAR operations, stepped forward sharply from his position near the triage desk. His voice carried across the controlled chaos with the precision of someone accustomed to being heard in loud places. Master Chief Petty Officer on deck. The room shifted again. Not a social shift. A structural one. The kind that happens when institutional hierarchy suddenly realigns itself to accommodate a detail that changes everything. Ashley didn't acknowledge it. She moved into Bay 4 and began the intake assessment with the focus of someone performing surgery, not nursing. Blood pressure cuff. Heart monitor leads. The man's hands trembled when she took his vitals, but Ashley's hands did not. Her fingers moved like they belonged to someone who'd done this in sandstorms, in darkness, in the back of a Black Hawk flying low enough to feel the earth rising up to meet them. Creatinine would be through the roof. Potassium probably at lethal levels. Nothing she couldn't manage. Nothing that was worse than what she'd already managed. Bay 4 is prepped, she said to the resident. Start aggressive fluid management. Hold off on potassium binders until we see the labs. Monitor for arrhythmia. I'll be right back. She moved past the stretcher without making eye contact with the man. She walked past Marcus Hayes without acknowledging the careful respect in his posture. She pushed through the double doors toward the administrative corridor where 3 people in Navy business attire were already being escorted toward the hospital boardroom by the chief nursing officer, and Ashley knew, with the kind of certainty that came from living 2 parallel lives for so long, that everything had just collapsed or exploded or transmuted into something else entirely. Within the hour, a Navy 2-star general stood in the hospital boardroom with a classified file opened across the conference table, and the pages carried photographs from another lifetime. Ashley in desert fatigues, her face younger and harder. Ashley in dress blues at a formal ceremony. Ashley in a hospital uniform, carrying someone's unconscious body through smoke. The general's name was Admiral Michael Morrison, and his voice had the quality of something that had commanded attention in combat zones and would continue commanding it everywhere else. He read from the file without inflection, like he was reading evidence in a court-martial, which, in a way, he was. 3 Bronze Stars. Awarded for valor in operations across 3 theater rotations. He paused while the board members absorbed this. Silver Star. Awarded for leading a classified extraction operation that resulted in the recovery of 17 service members from a hostile location. Another pause. The board chairman's face had gone very still. Navy Cross. Awarded for carrying 12 wounded sailors and 1 Navy SEAL through 4 kilometers of hostile territory during the Bagram Valley incursion of 2019, under continuous fire, providing life-saving medical intervention in field conditions while maintaining combat effectiveness. The silence lasted exactly 10 full seconds. Nobody moved. Nobody breathed. The fluorescent lights buzzed their particular electric hum, indifferent to the fact that institutional realities were being rewritten in real time. The board chairman spoke first. The investigators who came in, they're redirecting their focus. They are, Admiral Morrison said. He pulled another document from the file. Because they found something while pursuing the initial complaint against this officer. A pattern in surgical outcomes across Cedar Creek Medical that correlates almost perfectly with departmental performance metrics. Systematic falsification of surgical results. Early discharges time to move patients before complications would manifest on departmental records. Altered recovery timelines to boost efficiency bonuses. 7 preventable deaths among military beneficiaries alone. We're still counting the civilian casualty list. One of the board members, a woman with the careful expression of someone who'd just realized she'd been sitting at the same table as catastrophe, turned toward the chief nursing officer. Dr. Whitfield. Administrative leave, the CNO said quietly. Medical license suspension is pending. His retained counsel. He won't need counsel, Admiral Morrison said. He needs a new career path. The investigation is a formality at this point. Ashley was not present for this conversation. She was in Bay 4, managing the man who'd recognized her, running through the protocols that would stabilize his failing kidneys, checking the potassium levels that had climbed to 6.8 MEq/L, dangerously high, dangerous enough to cause cardiac arrhythmias, dangerous enough to kill him if she didn't move fast. She pushed 10 milliliters of 10% calcium gluconate through his full line, the medication binding to the potassium, protecting his heart muscle from the electrolyte overload. She asked the resident for insulin and dextrose, moving through the medical choreography with the kind of automatic precision that only came from having done this 1,000 times before. You remember, the man said in Dari. His English was barely functional, but the meaning transcended language. You came back. After you left. They said you were dead. They said all the angels were dead. Ashley prepared the insulin dose without responding. 10 units regular insulin for push, followed by 25 grams of dextrose to prevent hypoglycemia. The medications would drive the potassium into the cells, buying time until they could address the underlying renal failure. She'd done this before. She'd done this in a field hospital with a concussion and a broken rib. She'd done this in the back of an ambulance. She'd done this in a cave with nothing but a field medic kit and the certainty that if she didn't move fast, someone's daughter wouldn't grow up knowing her father. Your name, she said in English, not looking at his face. What's your name? He understood the question. Fahim. I am Fahim now. Before, I was someone else. Fahim, Ashley repeated, and she pulled a chair next to his bed and sat down, not because protocol demanded it, but because the man was terrified and alone and nobody else in the world knew what he needed in this moment except the angel of death, who was now a nurse at Cedar Creek Medical in San Antonio, Texas, waiting for the board to finish reading her file. 6 months later, Ashley stood near the front entrance of Cedar Creek Medical wearing her dress Navy uniform, the dark blue fabric perfect and pressed, Master Chief anchors gleaming on her collar like small promises made good. The Presidential Citizen's Medal hung in a frame under her arm, the ribbon a shade of blue that matched her dress uniform almost perfectly. The invitation had arrived 3 days after Garcia finally sat up straight in his hospital bed and said her name, the full name she'd never given him, the one that pulled 18 years into focus and made sense of every conversation where she'd promised something he didn't understand at the time. She paused at the glass doors and looked across the street toward the strip mall parking lot, where Dr. Whitfield sat at a folding table beneath a sun-faded umbrella. His medical license was suspended pending criminal investigation. His hospital privileges had been revoked. Security had escorted him from the building with the same procedure he'd threatened to use on her: professional, efficient, final. Now he sat beneath that umbrella wearing a polo shirt embroidered with an insurance company logo, selling policies that nobody wanted to buy from a man whose name was now synonymous with preventable deaths. He glanced up and saw her uniform. His eyes tracked the Presidential Medal. He looked away very quickly and pretended to be extremely busy organizing papers that did not require organizing. Ashley did not approach him. Some lessons teach themselves without intervention. Inside Cedar Creek Medical, the hospital president stood beside a door marked Patient Advocacy and Outcomes, and beside him stood Fahim, now physically recovered, wearing his own suit and the expression of a man who'd learned to exist in 2 worlds at once. Next to him stood Garcia in his navy dress whites, the tattoo visible on his forearm, her name, still there, still a talisman, still a promise that somebody remembered the angel of death as something other than a concept or a legend. And in the back row, wearing her mother's tarnished challenge coin on a chain around her neck, sat Emma. She was old enough now to understand why her mother had worked 2 jobs. Old enough to understand why some secrets kept people safe. Old enough to know that power wasn't something you took. Power was something you used to help the people nobody else could reach. Ashley accepted the patient advocacy position with a handshake and a statement that would be recorded and quoted in board minutes: power is not a title. Power is the ability to help. The medal caught the fluorescent light as she moved toward her new office, and somewhere across the street, Dr. Whitfield's phone buzzed with another customer inquiry that he would handle with the professional desperation of a man who'd learned, too late, that institutional power only matters if you use it to build something instead of destroy it. Subscribe to the channel and hit the notification bell so you don't miss the next story of hidden heroism and earned recognition. Like this video if you believe the quietest person in the room is sometimes the most powerful. And comment below, have you ever been underestimated by someone who didn't know your full story?